Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
Where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to the Men's Health Unscripted podcast with Pat and Cam. And our guest today is Jeff Langmaid. He is the evidence-based chiropractor and founder of Movement Chiropractic Studio here in Tampa, Florida. Jeff has some really awesome modalities at Movement. I have tried them out myself, so we're going to talk a little bit about that. But first, I kind of want to talk about chiropractic, just the practice in general. I think a lot of people don't maybe not know enough about it, or if you haven't gotten treatment, what can it do for you? So Jeff, give us a little bit of background about yourself, how you got into chiropractic, and kind of what goes into your education and training, and then we'll move from there.
I'd love to. First, I'll thank you both for having me on. I think, it's really unique what you've been able to do, each with a background in pharmacy and really a focus on being able to have men improve their health, right, through wider mechanisms than just the pharmacy alone. So I think I'll just want to say I appreciate you having me as a guest. I appreciate what you do, and I'm going to try to deliver as much as I can for the listeners on your mission. So my background in history, I'll try to skip the boring parts. My background in history of how I got into chiropractic was how many people actually do get into chiropractic, which is my dad had a low back injury. He was trying to avoid drugs and surgery. And he went to see a chiropractor, and he got a lot of improvement. And when I was at the time, I actually thought I was going to be a knee surgeon. In fifth, talk about a geek. In fifth grade, I did a presentation on endoscopic knee surgery. So that's what I always thought I was going to do. And I kind of, as time was on, I was like, man, do I really want to look down the barrel of a 5 to 8 millimeter, endoscope all day, every day? I'm not too sure. I was in college. I'm like, I'm not really sure what I'm going to do. My dad had the injury. Had a great result. I went back for Christmas break. My dad said, why don't you come in and meet this chiropractor? Go in and meet the chiropractor. Little do I know, I was kind of being set up. He was the alumni president for one of the chiropractic schools in the state of Rhode Island, which is where I grew up. And he says, have you ever thought about being a chiropractor? I met the guy 5 minutes. Sorry, have you ever thought of being a chiropractor? Not at all. Never at all. No, never at all. That's what started it. So the more that I learned, the more I actually knew and found that it fell in line with the beliefs I already had about health, but didn't have a name for. And then real long story is that I'm actually a legacy chiropractor because my great grandfather was a chiropractor with a disconnected lineage to me from 100 years ago, back when chiropractic was in its absolute infancy, studying literally from the Palmers, who are the founders and inventors of chiropractic as we know it today. So that's a little bit of my history, and kind of fast forwarding to today. I came out of school about 18 years ago, and I practiced just about every way you can. I was an associate at the chiropractor who got me involved in chiropractic. I was an associate with him for about a year, opened up my own small boutique practice in Providence, Rhode Island for about half a decade. And then I came back down here to Tampa, Florida, and I joined some orthopedic groups, some really large scale surgical and orthopedic groups, practiced that way for about 7 or 8 years at the time when it was really weird to be a chiropractor in those settings. Now there's chiropractors at the VA, et cetera. Back in the day, there was not, I can assure you that. And now I run a variety of businesses that help other chiropractors build and grow their business. And I have a practice here in Tampa, Florida called Movement Health. So I'm happy to go any direction, but that's the history in a nutshell.
Sure. So tell us a little bit about just what the profession entails. I mean, I think maybe the average listener, even in my mind, would think, well, I'm going to go in, I'm going to get my back cracked, I might deal with some injuries. But what exactly do chiropractors really focus and hone in on? I know this is a very broad question, but what are maybe some key features to the profession?
Yeah, that's a fantastic question. And I always say chiropractors are movement-based healthcare professionals. That's really the core essence of who we are and what we do. So a lot of what we do is with the neuromusculoskeletal system, with the bones, the joints, the nerves, the ligaments, the tendons, right? So as you mentioned, and as my father's experience was as well, many people are exposed to chiropractic. The top 3 reasons people go in to see a chiropractor, at least initially, is due to low back pain, number 1 reason. Number 2 reason, neck pain. Number 3 reason, headaches. But chiropractors really focus on, I'm going to say, the link between what we call structure and function. And that's the chiropractor's sweet spot. Are not only the joints moving correctly and without pain, but are they functioning at the highest level? And the best example of that today is in major sports institutions, the NHL, MLB, you name it, every NFL team, every NBA team, every hockey team, they all have chiropractors on staff. Now, the interesting thing, and what would surprise many people, is most of those chiropractors don't treat injuries. Those teams have elaborate systems of physical therapists, medical doctors, osteopaths that really focus on the treatment of the injury. Chiropractors are used in that setting, almost harkening back to how chiropractic was founded in the sports performance realm. Because we know that if you can move throughout a full range of motion with functional ability, meaning doing it well without a ton of compensations, and that you are able to have what I'm going to call just a great, this sounds a little esoteric, but brain-body connection, because we know the spinal cord goes down the spine and then it goes out through the foraminal canals to every cell, to every organ, every tissue in the body. When you're able to have great range of motion, when you're able to have great, what we call, this sounds technical, segmental biomechanics, is every joint of the spine moving and functioning appropriately, then your expression of health is better. What does that equate to? Less risk of injury, better mobility. And ultimately, the really exciting thing we're seeing in research is the potential sports performance benefits from it. So most people get in due to pain, but most people stay due to performance. That's probably the easiest way to say it. And while chiropractors focus on the spine because it's the easiest direct conduit to the nervous system, many do also have other areas of interest that might go to the extremities, your wrists, your ankles, your shoulders, your knees, and maybe sports performance. Some chiropractors like doing more on the pregnancy care and things like that. So just like I always say, there are different types of attorneys. If you say you're an attorney, the next question would be, well, do you do personal injury, maritime, court, are you in the courtroom? Are you behind a computer all day? The same thing can be true of chiropractors, where there's a lot of different approaches under the umbrella of chiropractic. But I think the unifying factor is nearly every chiropractor is focusing on moving, helping that person move and function to their highest ability possible. And often that's through the conduit of what we'd call a chiropractic adjustment, but not always.
Yeah, it's exactly why I got into a few sessions with a chiropractor back when I played football in high school. Same reason, sports, you want to get the best movement, the best, functionality out of those joints. So I did a few sessions for the season, just kind of crack around and get into better shape. But yeah, it did. It felt good, felt nice, comfortable setting. Like it wasn't, when people think about chiropractors, you always kind of go to that like stereotypical, they're gonna like crack your neck and then break your spine, and then you're dead. But it's one of those like myth thingies that I'm sure you guys have to shake, and can be kind of difficult with some patients. I'm sure they're a little concerned about the adjustments.
You're 100% right. And I'll touch on that for a moment because I think it is really important. Chiropractic, contrary to what we might believe or see on television, chiropractic is just about one of the safest professions out there. And how do we know that? Well, we know that because, quite frankly, our malpractice is ridiculously cheap compared to almost every other profession. And the insurance companies, believe me, if it was dangerous, they would charge us for it, right? So that's a simple one. But the other one is that, and I'll get a little geeky on the science, but I'll try not to lose everybody listening and watching here, which is when a chiropractic adjustment is delivered, the goal is to get into what we call the paraphysiological space. So what does that mean? That means it's beyond the normal range of motion, but before you get to injury, right? So we've all seen Rambo or something like that. Like that's outside the paraphysiological space, right? Rambo gets up behind the guy. You might hear the crunch, but he is far into the injury territory when he's taking out somebody at some overseas base from behind, right? But when somebody's delivering a chiropractic adjustment, the goal, and really, it's rarely that it's not the case. Can things happen? Yes. But actually one of the most number one, I'm going to say, if there is a risk, one of the most number one challenges, which is just the way it goes, is sometimes you can get a little fracture of the rib. But that's a totally different thing than breaking somebody's neck, right? And a lot of times that's with people who have advanced osteoporosis because their bones are a little bit brittle. So that's something we're always cognizant of as chiropractors. But the number one thing is you really want to get beyond what the patient is moving right then, because as you said, hey, you've got restricted range of motion. There's something to be said about treating that, let's say, more in a physical therapy realm where you might just go through that range of motion many, many times and extend it over time. The goal of that adjustment, the goal of that treatment via chiropractic is to enable the body through a fast motion, very brief. That's why we call it a high velocity, low amplitude adjustment. Not a lot of force. You're not trying to force things. You're trying to have speed be your lever and advantage to give that person increased range of motion well before you get to the territory of injury. And when you do that, that's the quintessential benefit of the chiropractic adjustment because of all the physiology that happens from there.
That's awesome. That's a great explanation of
Yeah.
kind of where we're going. So we'll just dive right into movement health, right? I had a great time. You guys really helped out my knee. I'd have to say it, one treatment really made a huge difference. And so on the podcast, we've discussed shockwave therapy before for different things. You and I discuss it right now. I think the hot use for shockwave therapy in America is either for kidney stones or for erectile dysfunction, but there are so many modality for treatment for a lot of different things. I know in Europe they use it for patients with heart disease and previous heart attack. And now, just talking with you, there are a lot of areas like for joints. So breaking down inflammation, things like that. So how exactly did you take all of your knowledge and experience from all these years of practice and decide shockwave and movement health was kind of the direction that you wanted to lead your career in?
I'll say right off the bat, if somebody's looking for kidney stone changes or erectile dysfunction changes, we're not the practice for them. So
Right.
yeah, you're 100% right. We are focused on we're focused on hips, ankles, knees, shoulders, and all the extremities. And what I saw was and you kind of alluded to it, which is shockwave technology is not particularly new. It's been around since probably the 50s, 60s, 70s, whatever it might have been when it was originally discovered to assist people with reducing kidney stones. So there's nothing that's particularly new about it. I like to think about it like, the story of the microwave, right? Somebody's working on a radio wave, has a chocolate bar in their pocket as they're working at their office. And that's how we discovered microwaves as we know them today. Chocolate bar melted. The scientist was working on a unit for radio waves, but the chocolate bar melted. And that's how, long story short, is that was the advent of what we now know as the microwave to heat up our food, popcorn, or whatever else. So I think of shockwave very similar, meaning the advent of it was through kidney stones, but over time, there's been a variety of different uses, as you sort of alluded to. And there's a few things that interest me specifically about shockwave as a provider. One is, I'm going to say, the ability to have repeatable results. So that's something that's very interesting. And I think shockwave has proven itself to be able to deliver very, very repeatable results. So there are things that we know are just going to be absolute slam dunks. And I'm happy to go into those things. But there are just, and that's really nice from a practice perspective because it allows us to not only focus our messaging as a business owner on who our ideal patients are, but it also allows us to deliver a very high level of consistency with our results, which are what the patients care about, right? So Shockwave is a great tool and technology that allows us to have a lot of repeatability in our results. Man, I feel like I'm talking super technical right now. But ultimately, that is what got us interested. The second thing is I've always liked technology. So, me and my co-founder, we always are looking at what are some, unique items that we can make available within our business. And this is the fine line. We always want things that have a proven track record, but maybe aren't everywhere yet. And that's a hard thing, right? It's like, well, what has a really proven track record with a lot of research supporting what it does, how it works, the benefits of it, but it's not on every single corner yet. And the more that we learned about Shockwave, the more that we could see that it fell within that bucket of what we were interested in providing in our community. And it was something also that we felt like had a really, really strong need, which I'm happy to get into for people that want to avoid surgical intervention. Then there's a time and a place for that, don't get me wrong. But for many people having elective surgeries, they'd like to at least delay that as long as possible. And or potentially they're like, man, I might not be back to being a 20-year-old with this treatment. But if I could get from a 7 out of 10 pain per day to a 3 out of 10 pain, I'm happy to live with it because then I know I can do the things that I want to do with my friends and family and colleagues and loved ones. So those were really, I guess, some of the high level thoughts that we had when we brought Shockwave in.
No, that definitely checks out because the repeatability is a very important, point that you brought into that because a lot of people Maybe we experience it in school as well. They're always, oh, we got to innovate, we got to change things, we got to make, you know, more efficiency, things like that. But that problem you do have is a lot of times you may get like a one-off result, and you're like, well, all right, this is great, and then you can't repeat it. And then everyone's different. Everybody's body condition has issues that are different from everybody else. So trying to find something that's even at the same time repeatable is not going to be the same, but you can still get it close. Um, what are other than shockwave? What are some other examples of like new modalities that you guys have implemented?
Well, that's a great question. So our prime modality right now is shockwave because of all the benefits that we've seen. But I can talk on a few things that we haven't implemented yet that I think are pretty interesting in terms of what they're able to do. And in my opinion, there's a lot to for lack of a better way to say it, I'll say stacking some of these things. So, and here's what I mean by that. I think there's a lot, and we see more practices implementing what I'm about to say, which are more recovery type centers. So we might know them as cryotherapy, as sauna. Maybe it's more of a home thing than a practice thing. Class 4 laser, I think, is a really good one. We also see the air compression. I'm thinking like the Normatec pads right on the lower extremities that really blow, and that allows the blood flow really to get energized. So I like a lot of the things happening in the recovery center type space, because I believe that there's just a lot of benefit there at a pretty low cost. And ultimately, it's preventative by nature, which I think as a chiropractor, we always have a soft spot as opposed to being reactive, but helping our patients, our communities be as proactive with their health as possible. Because it's a lot easier to, it's a lot easier to never encounter a problem than encounter a problem, but then it's a lot easier to take care of a small problem than a big problem, right? These things compound over time. So I love the recovery and performance center aspects. We haven't implemented that in our practice yet. We have a pretty unilateral focus on shockwave, but I think there's a lot that we're going to see and learn, and I believe there's going to be a lot of practices adding on relief and recovery items as time goes on. So in my opinion, this is kind of a shift from maybe what we would traditionally view as a med spa or these nice to haves. I think over the next 5 to 10 years, there's a lot more practices that are going to be talking about them as they should be, which are more need to haves. They're a need to have if you want to live a healthy life, perform as long as you can, and have the highest quality of life possible. Then they're a need to have. They're a nice to have if you're just trying to get by every day. But most people, if you ask them, especially those before they get sick or ill, would say, man, I don't want to get sick or ill. I'd rather maximize my opportunity. And to me, many of what we would traditionally call alternative or ancillary modalities, I believe are going to become much more part of what people do day in and day out. And I think we've already seen that compared to 20 years ago. It's a world of difference already, but I don't see that stopping anytime soon.
For sure. There's a huge shift to now proactive health and preventative medicine. And while a lot of times you have to cash pay for those things, not so much, insurance coverage. I mean, they don't give you a whole lot of prevention. They're just ready to kind of like sick care you. That's something that the pharmacist probably sees the most out of anybody. But I kind of wanted to talk about, how you guys are using shockwave. There are, a lot of different uses. What are some of the primary uses, and maybe some are like, what are the limitations as far as like, I know for a fact that it works great on knees, ankles, wrists, shoulders, things like that. What about the deeper areas in the body? Those type of things. And I know like I just want to maintain like, where you guys are keeping your focus, and knees, ankles, wrists. I mean, those get hurt all the time. I think there's probably like no shortage of people that might be looking for this service.
Yeah, and I think it's important to highlight that shockwave is a term that's used, and it's a little bit of a blanket term. So there's some different classifications. I think this is really important, is that there's a couple different classifications of shockwave units, and they're pretty different. So there's everything from what we call radio pressure to piezoelectric to electromagnetic to electrohydraulic. So okay, it sounds like I'm giving everybody an engineering degree right now, but ultimately there's a variety of different applications. And while the units sometimes look similar, there can be a pretty wide change in the technology. So our focus is on the electrohydraulic, the last one I mentioned. And the reason for that is that electrohydraulic has a narrow focal zone, so it allows us to be really specific, and it has a high depth of penetration, could be up to 10 centimeters or so. Something like a radial pressure might only go half a centimeter. So we're talking about a really big difference in terms of the depth of penetration. And something like a piezoelectric might have a wider focal zone, but not go as deep, right? So there's a variety of different types of shockwave. I'm going to specifically talk about the electrohydraulic because that's what we utilize, and it's kind of the Cadillac, for lack of a better way to say it. It's kind of the big enchilada. So it's the most expensive unit to buy, I can tell you that, but it also gets the best. It also gets the best results, which is why we chose it, especially because that's our primary focus, right? So how the electrohydraulic works is very similar to if you've ever seen a supersonic plane, you know, the sonic boom when it takes off and then it goes, right? You hear that boom and then that thing takes off. Inside the head of this unit is something that looks kind of like a spark plug. That's what we call the electrode. And there's actually electricity that goes across that thing, just like a spark plug would. And that sits in water, actually. It sits in salt water. You put a bunch of salt in the head and water, and you might say, wow, salt and water and electricity don't normally, and you'd be correct. That's where you get the shockwave from, right? So that's a pretty a potent way to create an energy transfer, electricity and water, right? Now, when we talk about shockwave, and when I'm saying this, I want to be super clear with everybody. I don't believe there's been a single human being that's ever been shocked via shockwave like that, you know, so there's no electrocution going on. But what it creates is similar to, I think most people can picture how a kidney stone is broken up. It's like a thump, right? It's a thump. Or if you think about at, a supersonic jet level, you hear that big sonic boom. Clearly, this is not at the level of a jet engine, but it's taking place in the head of a unit the size of a baseball or so. So it's creating that thud or that thunderous sound. What that does is transfer energy. That's like a thud, so to speak. And what that thud does is that thud is the energy transfer. And the energy transfer is what starts the process. So that's a long-winded way of getting into the answer to your question, which is our focus when we talk about 10 centimeters, it might be difficult to really ascertain how deep that is, and difficult for me. And I'm a doctor living in that world each and every day. But on what we'd call extremities, you get really great results. And when I talk about extremities, what I mean by that is our focus is really knees. Number one, people that have degenerative changes, arthritis, meniscal tears, sprains and strains. These are really, really, really great things to be able to take care of with shockwave. Now, if you have a 100% torn ACL, the shockwave doesn't magically put the ACL back together, right? But if you have a tear and it's not a complete tear, it can help that healing process. So knees are an absolute slam dunk. Shoulders, really, really great, especially people that have things like frozen shoulder, excuse me. This is a really great modality for something like that. Carpal tunnel in the wrist, great modality. Golfers and tennis elbow tendonitis in medial and lateral of the elbow, really great for that. Plantar fasciitis, really, really great for that. Ironically, we've seen that for spine issues, it can be good, but often something else is required, whether that's a traditional chiropractic adjustment, spinal decompression, whatever it might be, because the spine sits further in on the body. And to get to those areas, the depth of penetration has to be greater. We can get in there, but it becomes a lot more multifactorial. So long story short is knees, hips, ankles, shoulders, wrists, those are really our bread and butter.
Yeah, I'll even say from my experience there, it feels like somebody's just like kind of flicking you in an area.
Right.
It's not a painful thing at all. I will say, like going through the full diagnostic on my left knee, there are some areas where I guess the problem areas where you go over, it's like a zap,
Yeah.
right? Like
Yeah.
it's not an electric zap, but you're like, oh, okay, that might be where I'm having some issues just from a personal account. Like definitely not painful at all, though. It's like a thumping flick type feeling.
Yeah, and I'll touch on that really briefly. This is something that some people might be familiar with, as I mentioned, like class 4 laser or something like that, or infrared light or red light. Those are things that, like a vitamin, you don't feel, right? You kind of go and you get the care and treatment, and they can be very, there's a variety of different types and kinds and all this kind of stuff, but there is a big utility for that. Shockwave is different. As you mentioned, Patrick, you're going to feel it, right? So this is something that you do have direct feedback and input, unlike some of the other modalities, which might be a little bit more passive in terms of really saying, well, I don't know, this the benefit I'm going to see as time goes on. This is something where not only are you feeling it during the diagnostic, that feeling, that feedback that you're giving us as a provider is really important to then being able to identify where the therapy, where we're applying the therapy, which the diagnostic in this case is the therapeutic, but being able to get into those really challenging spots. And our goal on visit number one, at our practice, and I think many other practices that use Shockwave, I don't think we're unique in this, is that our goal is that patients at the end of visit one have an improvement in either range of motion or decrease in pain on visit number one. So not only are you feeling at the time, but that's part of how we determine whether or not this is the right modality and whether we make a care plan recommendation, is that our expectation is to see pretty much an immediate effect. Now, that doesn't mean you go from a 9 to a 0 out of 10 for life with one treatment. That's not how the body and physiology works. But we're looking to see, as I like to say, we want to see the door crack open. We want to see a ray of light. We want to say, if we're able to get some improvement today, some improvement, a little bit more motion, a little bit of pain relief, that is a great indication that there's more to come and we're on the right track.
So with that, how long typically do patients have in between their sessions? And then how many sessions are recommended for either a full care plan or life if needed?
Yep. So the answer is it depends based upon the person. Somebody coming in that's a young athlete with a partial MCL tear is going to be different than somebody who's had, 2 knee replacements and a bunch of challenges around it that's 85 years old, right? So there can be a variety of difference, but I'll give you the general. The general is that we normally start 2 times a week for 2 weeks and then once a week for 4 weeks. That's usually the way that we start most care plans. There's exceptions based upon what I said, but we want to be able to make sure that we're getting enough input in early. So we want 4 visits really within those first 2 weeks in order to really stack up the cards in our favor, right? To give the body the input, to make sure that there's enough input into the body via the shock waves to start kicking off the healing process beyond just the relief on visit number 1. So that is the way. 2 visits a week for 2 weeks, 1 visit a week for the next 4 weeks. That's normally the way that we start. Based upon the total care plan visits, I'm going to say that they average between 8 to 16 visits, depending upon the severity, age, and for those factors that we mentioned. How old are you? What have you dealt with? How many areas? What are really the problems in the area? I'd say about 8 to 12 visits. So for most people, they're coming in for, I'll just rough it and say, kind of 4 to 8 weeks. And for most people, most of the time, this is something that has a beginning, a middle, and an end. So for some patients, maintenance can be beneficial. Those individuals that know, they're kind of in line for surgery and they might not be able to avoid it forever, but that they want to try to avoid it as long as they can. Maintenance can be very good for somebody like that, or somebody that has the repetitive nature of their lifestyle is what drove them to have the problem in the first place. And they go back to doing, like most people most of the time, that go back to doing those things, again, as I always like to say, time and gravity are undefeated. Well, we can't turn back time and we're not going to be able to take away gravity or previous injuries. But for people that have more acute injuries, more of something that's a specific problem that's happened one time, there's typically a beginning, middle, and an end, and there's no further treatment necessary. For those individuals that have advanced degenerative changes, we see big benefits for those, but those individuals we might recommend, hey, coming in once or twice a month for a tune-up based upon what's going on with you might be a good idea if you don't want to slide back over time. So depends on the patient, depends on what's going on with them, but those would be the general buckets of what we recommended see.
Yeah, that's pretty interesting. I mean, I can only imagine somebody who is very close to a knee replacement, very close to a hip replacement or something similar, and they go get some shockwave and you stave that off for a while or even prevent the injury. I mean, so what exactly is going on, let's say, in a knee? Maybe from a physiological perspective, what is that thump or that kind of jolt doing that's allowing that repair to take place and give them some benefit within the first session, like you said?
Yeah, that's a really great question. So I want to first say I am not an expert in the physics of it, but I'll do my best.
Okay.
So if somebody looks up what I say and it's a little bit altered, then I greatly apologize. I'm going to try to be as accurate as possible. My understanding of what happens initially is that essentially it affects the sodium channels at a cellular level, and the sodium channels at a cellular level contribute to pain gating. So you get the gating of pain due to the impact on the sodium channel at a cellular level and the fact that you're getting a mechanical input into it, right? So those two things together sort of gate pain. And when we say gate pain, I'll oversimplify it. You guys know what I mean. But for the listeners, I'll try to simplify it down a little bit, which is, you have every nerve in your body, every cell, every tissue, every organ is connected via the nervous system to ultimately your brain. And your brain is what processes pain, right? So now it processes pain based upon the inputs it's getting from wherever those nerves end up terminating, right? Whether it's your knee, your hip, your ankle, your shoulder, your finger, wherever it might be. So the interesting thing is that when you think about how a signal travels along a nerve, basically, I'm oversimplifying a little bit, but basically it's like one lane of traffic. Basically, the body's either saying this is moving, and we call that a mechanoreceptor, right? It's understanding that there's movement, and it's saying this, and that's how we know that as proprioception, where our bodies are in space. Close your eyes and you know where your hand is, right? We know proprioception is our understanding of our body's ability in space. So when we gate pain, it's really interesting because if you have a bunch of here's where I am, mechanoreceptive information going up, it actually turns off temporarily the pain receptor. It's almost like there's only one car on the highway, and it's either got to be the here's where I am in space car or the pain car, if you want to oversimplify it that way. So when there's that force, when there's that thud, when there's that tap, there is a component of that that's mechanical, meaning it literally, your body's like, okay, well, we can feel this thumping. So, we're going to tell the brain that there's thumping there, which inevitably acts as a pain gating mechanism in and amongst itself. Now, that's pretty low level because I could just flick you on the shoulder and have a little bit of that go on, right? So that's not really what we're after, but it's part of how it works. The second part of how it works is when that energy is put into the body, that shockwave is put into the body. The way that I've seen it is like an EKG. We've maybe not everybody listening, including myself, by the way, knows how to read an EKG, but we all know what that looks like. A big spike goes up. We've all seen ER back in the day or something like that, or you know what that looks like. Where almost like if you want to think about it, like something that tells an earthquake coming, right? It's a big
seismograph.
spike. Right. A big spike. And that's what that's the benefit of the shockwave is it and the electrohydraulic shockwave is it gives that big spike. And something unique happens when you get that big spike as opposed to the little puttering along. That big spike is what ultimately affects the sodium channel at a cellular level that gates pain even further. The second component is the mechanical aspect of the shockwave going into that joint basically acts as a little bit of flushing out and pushing out inflammation. And we know the chronic pain epidemic, it's ultimately intimately tied to a chronic inflammation challenge, right? So it's very rare that you'd have a degenerative arthritic joint with chronic pain that doesn't have inflammation as one of the core contributing factors to why there's pain there, right? So this is where when it does a really good job, shockwave's not a panacea, it doesn't help everything, every time, everybody, but what it does is a really good job at turning off the pain signals and pushing out inflammation. And when you push out inflammation, well, guess what? You start to feel a little bit better and move a little better. And what is the number one factor involved with healing is motion. Motion is how our body actually heals over time, right? Especially when you were talking about a joint that's dysfunctional. Most of the time we stop. What is frozen shoulder? Well, it's when you have a shoulder challenge, you stop moving your shoulder, and then you end up with frozen shoulder, and then you really can't move it, right? So we all know these things to be true, and shockwave is a great facilitator of that. So what it does a really good job of, coming back around and saying this in the most simple fashion possible, is it turns off the pain signal temporarily. It pushes out inflammation. Those two things allow the person to move more and move better, which then starts a cascade of healing processes that are the total natural healing process of the body that have been around since man has been here. So it does that. Now, there also are some really technical things regarding like proteoglycan, stuff that you guys probably know a lot more about than me, in terms of how it actually stimulates the healing process long term at it's not stem cells injected, but at a stem cell type capacity that are far beyond what I can feel comfortable explaining today. But that's how it works, at least in the initial. And then the compounding benefits of, I'm going to say, facilitating the body's own healing mechanisms long term, or what it does a really good job of. And I don't feel qualified to talk about it.
I did read a little bit about it before I went in, and it seems like the stem cell discussion is more like that kind of spike or that kind of influx. You clear the inflammation, and it's almost like a signal to, I don't even know if I'm putting it right, but like send the stem cells kind of that way and kind of get the healing back going. That's like really dumbed down and possibly, half correct, but that was just kind of how I was reading about it and kind of how I understood that the primary function is to get rid of the inflammation. I mean, once you clear a lot of that out, and especially years, if you have inflammation that's been built up for years, right? Like that has some degenerative qualities there as it is. And once you kind of start to clear that out, like, yeah, you'll get a much better range of motion, but also then it allows the body to pump more blood, more nutrients and things into the area that allow for healing and kind of getting that area back, like just its general nutrient absorption, right?
Yeah. Yeah. I mean, and you're touching on a really great point. I'll clarify a little bit of my statement. Short-term inflammation is really good, right? You twist your ankle,
Sure.
inflammation is the first step of the healing process, right? It's an absolute necessity. The problem is when acute inflammation, short-term inflammation becomes chronic or long-term. That's when the problems start. So acute inflammation is great. If you don't have acute inflammation, you're never going to heal. It's the first step of the healing process. Absolutely critical. Our bodies are designed wonderfully. But when that doesn't go away, because you continue to injure the area, you don't do what's necessary to heal it, you go back to, or there's a variety of reasons on why this can become chronic. Chronic inflammation is the bear. Chronic inflammation causes the real problems because we know that over time, chronic inflammation can contribute to the degenerative process. It can contribute to a higher likelihood for early degenerative changes, a higher likelihood for earlier arthritic changes, a higher likelihood for all of the things that nobody wants to deal with, right? So typically that is due to chronic inflammation. So to your point, when a joint is chronically inflamed and somebody's compensating, they're not moving correctly. We've all had this happen, right? Where it's like, I woke up and, my knee hurts a little bit, so I walk a little bit different that day. And we've all probably gotten away with it a few times. But we've all probably had a couple instances in our life where, we're like, oh boy, now my other legs hurt. Like, we all pay the piper for the compensation effects. And that becomes a really big challenge when we're talking about hips, knees, ankles, shoulders, et cetera, especially knees and ankles, weight-bearing joints. As time goes on, we start to see that one joint goes, then the other joint goes. And anybody that's dealing with these issues, I'm not saying anything new. They're probably talking about these things with their doctor every time they see them. But what shockwave does, and to your point, and I'll kind of come back around on, is healing begins with inflammation, but when inflammation hangs around, inflammation causes the problems and stops the healing in its tracks, dead stop. So when you're able to push out inflammation, especially when you're able to do it naturally and move more, moving then also facilitates the healing process. Movement is what facilitates bringing in nutrients into the area. Movement is what facilitates bringing in stem cells to an area via blood, obviously. Movement at a unbelievable cellular level can almost be considered micro trauma when a joint hasn't been moving. And that micro trauma causes acute inflammation, which begins the healing process. And then you start to actually facilitate what the body was trying to do the first time, which is, the body, we always say in chiropractic, the body needs no help. It just needs no restriction. And often we've restricted our ability to heal. And it doesn't mean we're trying to do that on purpose, but it means we weren't either set up for success, we had a challenge that wasn't taken care of correctly, we didn't follow our doctor's advice, all of those things happen, or we're just been on the planet a while, again, gravity and time being undefeated, and ultimately things have caught up with us. So really, I'm going to say one of the best things that shockwave does is to provide fertile ground for healing. beyond, a magic lightning bolt going in. No, what it really does is transfer energy in a way that allows the body to heal at a rapid rate. And the body traditionally can heal at a rapid rate when it doesn't have obstructions to that healing process. And often chronic inflammation in a joint, fluid collection, etc., becomes the encumbrance and the challenge that is in making it impossible for that person to get well. So I feel like I'm talking super technical right now, but I'm trying. But that's where we've seen the most benefit.
The technical talk is that's really important. I mean, our audience wants to know. We kind of get back down into the nitty gritty. I think that Cam and I walk a really nice fine line of not going to over science, but then keeping things very simple. And then, you've done a great job. You explain the science, you kind of simplify it. Yeah, I mean, it's digestible for everyone. So kind of moving along those lines is we've kind of talked about what shockwave does and things like that, but I guess who are the people maybe most at risk for those type of injuries? So are we talking athletes, or are we just talking, like you said, people who have just been around for a long time? Or maybe performance, CrossFitters, weightlifters, things like that. I mean, is there anybody who you've seen more benefit in than others? To really like kind of hone in on what type of, treatment this modality can provide for someone.
Yeah, that's a great question, a really hard one to answer, and we could get real deep real quick, and I'll try to keep it brief, which is the bottom line is any individual, we know pain, we say pain, pay attention inside now. That's the way we think about pain. Pain is your body's way of giving you that light on the dashboard saying there's a fire. It's not the fire. The fire is the problem. Pain is the result of the problem. We also know pain is the last thing to come and the first thing to go, meaning a joint is dysfunctional. Now, sometimes this happens all at once. You think about a car accident or a football injury. Sometimes the dysfunction happens right when the pain starts. It's like that's a big acute, but more often than not, that's not the case for many people. Is that it is the joint becomes dysfunctional. They change how they move. They have a repetitive issue. And then over time, the pain comes in, and once a week pain becomes once a day, becomes once in the afternoon, becomes once an hour, becomes now I wake up and by noon I'm taking an NSAID and I'll leave because now this is my life, right? What the blank happened, So that's I think that's an important component to just highlight because pain also should be the first thing to go. But just because in the absence of pain doesn't mean that you are fully healed. Often you have made your biomechanics change. You've changed how you move. You've changed how you've done things. Your body's become deconditioned. So there's a really important component, I think, regardless of the doctor that you're seeing, to understand that. Because I know us as patients, including myself, we get itchy trigger finger. We're like, yeah, I don't want to be here any longer than I have to. I'm feeling a little bit better. I'm out of here, right? And most of the time, if your doctor is making me recommendations, even though you're feeling better, I can say they're not trying to take advantage of you. They're trying to facilitate the best long-term result. So it's important to understand that after pain has gone away, then the real work begins. And we know that because for remodeling of ligaments, of tendons, of bone, can take 18 months, and remodeling a bone is a lot harder long term. Let's say it only is really going to happen in isolated instances. But let's just talk about cartilage. Let's just talk about ligaments, tendons, etc. That can take up to 18 months to really for the cellular matrix to change over time. So that doesn't mean you need to see a doctor every single day for 18 months to get maximum benefit, but it does mean every process takes time, and it does mean pain is the first thing to go, the last thing to go. So in terms of then applying that to who are sort of our ideal patients and who gets the best results, I'm going to say twofold. One is those individuals, and I don't say this lightly, but those individuals, a lot of it has little to do with the technology and a lot to do with the patient. Our best patients are those that are motivated to get well. And that's almost everybody's going to be every patient's going to get the best results if they're motivated to get well, right? So the best people that we see are like, this is what's holding me back. We like to call it the life impact and life effect. This is what I'm being held back from. This is what I want to get back to. That tells us that we're at a really good level of being able to have a really good patient experience in our practice. Now, clearly, they have to have something we can take care of, right? So then what are those things that we take care of? So I don't care about whether somebody is 16 years old or 65 years old. The question for me is, do you have something we can take care of? And that can be wide. We touched on some of them earlier. Do you have a partial tear of a ligament? Do you have an itis, an arthritis, a tendonitis, a tendinopathy, whatever it might be? Do you have bone on bone, which is not really ever bone on bone, but do you have bone on bone joint pain? Do you have, so hips, knees, ankles, shoulders, and those, if you start to combine those in a Venn diagram, that's what we take care of, right? So generally speaking, that is our sweet spot. That's what we like to take care of. That's what we, and then you say, well, of those people, who performs best? Doesn't matter to me if they're 18 or 80. Are they motivated? Are they interested in getting well? And do they have something that we can take care of without a red flag? And to be clear on a red flag, I'll highlight what that is. If somebody had an active cancer, a metastasis, a bone, an osteosarcoma, a bone cancer in their shoulder, and they also have let's say a tear of a tear, a labral tear, something to that effect, let's say in their shoulder, we're not going to treat an area that has active cancer. So that'd be a red flag for us that we'll take care of their shoulder injury after they receive the care that they need for cancer, et cetera. So there's a couple red flags. We're not going to go over a pregnant, we're not going to take care of a mom's low back when they're actively pregnant, right, with the baby right there. So there's a couple things that we'd say are red flags of injuries that we can't take care of. But if it's an extremity, a hip, ankle, knee, shoulder, if it's got an itis, a tear, or something like that, and the patient's motivated, regardless of their age, that tells us we're probably going to be in a good spot to get a positive result.
I like that criteria was that the patient is motivated for it, because healthcare, medicine, practice of, I don't know how you would say the active form of it, chiropractic.
Yeah, chiropractic. Yeah.
That's it. All right. It doesn't have any kind of specific patient groupage, like per se, diabetes has a certain, type and things like that. Because even like super healthy and super fit people will find themselves in instances where they need it. So probably just as much, if not more so than maybe some of those who aren't as healthy, aren't as active and things like that. Because like I spoke about earlier, I went when I played football in high school. I developed obviously a lot of joint issues with my time in the Marine Corps, so I haven't seen a chiropractor for it yet. But when you brought up that the VA's got chiropractors now, I knew that, and I don't know why I didn't think about that, because that'd probably be pretty useful for like my knees and my hands and some other issues like that.
Yeah, you're absolutely right, and I think that's really the biggest thing, and that's part of the biggest challenge with I think people out there being able to, how do you choose not just a chiropractor amongst any, but how do you know to see a chiropractor, right? So, and that's a really big challenge because it gets back to, I'm going to say two things, a little bit of a lack of understanding of what a chiropractor can do for many people that haven't had the experience that you've had, Cam, previous experience. But many people going, they can be a little scared. They can be a little unsure if that's the right place to go or the right place to be. And those are, I'm going to say, those are normal emotions for people to have. So anybody, listening, watching, that's like, yeah. And my big thing is, I guess just in a general context, I always let people know, look online, look on reviews, look on people's Google reviews, see how other people are doing, check out providers, their website, see if their messaging, resonates with you, and see if they seem like they're going to be the person. For example, there's a lot of, and I talk about this in the marketing world with chiropractors all the time, right? Where it's like, there's a big difference for a patient to visit your website as a chiropractor. And if that patient is a golfer, they're looking to golf better. They're looking to stay out on the links. They got knee pain. They've been waiting all life to be able to retire and play golf, and they're being inhibited from it. Well, if that chiropractor takes care of golfing people, I'm going to tell you a whopping piece of marketing advice that I give to chiropractors all the time. That is, I say that tongue in cheek. Have a golfer on the front page of your website, right? So when a golfer visits, they know how to choose you. And you'd be shocked at how many providers, we as providers get blinded. We want to take care of everybody, right? It's like we're bleeding, we're caregivers, right? So we're like, we want to showcase everything. And I'm like, I can guarantee you, if I'm a golfer, I'm looking for a chiropractor to take care of me, or I'm not even sure if a chiropractor can take care of me. And I visit one chiropractor who has golfed the 17th thing down on a menu that I'm never going to hit. And there's a pregnant lady on the front cover of the page. And then I visit the next guy who's 2 streets down that is completely focused on Titleist Performance Institute certification. The golfer's right there. We help people drive farther, stay in the game longer. Well, I can tell you which one 99% of people are going to choose. The irony being is that as providers, we often feel like, well, I don't want to become myopic. And the irony is, as we say, the riches are in the niches. But from a patient choosing perspective on the other side of that, it's really important, I'd say, for all patients to check out Google reviews, visit the website, see if they resonate with who you are and what you do, and do they have clear messaging. And that's a really important part about picking the right kind of provider, regardless of who that provider or that provider type is, in my opinion.
Very informative. And I know, like, if you could put golf, tennis, I mean, all those sports, you put them on your front page and it'd probably resonate with a lot of people, because I think like we kind of said at the beginning of the podcast, I think a lot of people are like waking up to, oh, wait, I can prevent injury, I can recover. And then, you have so many places. And I think that even now there's probably not enough. Like, you could probably add more, but there's so many places that are opening up that do the recovery, like the Normatec and things like that. And I haven't really seen anybody who did shockwave until I met you guys in the different capacities, right? And I was like, oh, wow, that's interesting. And when I did it, I felt different after the first treatment. And, I think something big too, after you receive a big treatment like that, which I was kind of made aware of, was don't take ibuprofen, try not to take any anti-inflammatories after for a few days to see if that initial treatment really helped. Because if you start stacking certain modalities, then you don't know which one actually worked or made you feel better.
Yeah, you're 100% right. And I think there's two important components to that. One, that you guys know a lot more about me, so I'll start with the one that you touched on that I know about, which is the first component is you want to have an accurate assessment. Right? Ultimately, that's what you're saying, and I couldn't agree more. So being able to have an accurate assessment of did something help and how much is really, really important. And to have an accurate assessment, you often need a clean slate, as you're kind of describing. The second component is, and there's plenty of medications that people live on and save their life, right? They wouldn't be able to, so there's value there. But on the other side of the token, there's side effects, and there are medications, as we know, with many, specifically, I think about corticosteroids and epidural steroid injections in the spine, which can actually facilitate the degenerative process. Now, it can gate pain short term very well because you're dumping a lot of steroid in a super specific area. But you got to pay the piper. And we've seen that actually at a cellular level completely reverses the healing process short term and can actually contribute to a higher likelihood, I should say, for advanced degenerative changes long term. Most people kind of know that because if they're resonating with this, they probably know that their doctor says, well, you can only get 3 injections per year, right? So obviously more is not better. But it also goes to show there's a reason why that's the recommendation, is because there are negative ramifications for these things as well. So I think, being able to, regarding medication and shockwave, as chiropractors, we make no recommendations based upon medications other than specifically related to elective over-the-counter things that we might make a suggestion or two, but that's not our area of expertise. Certainly is yours as pharmacists. But so better than I do. But it's not only getting an accurate assessment of the pain, but it's also giving your body the best ability to maximize that result based upon avoiding the negative side effects. And again, there are medications that are absolutely a necessity for life, when we would never, no providers would ever make a recommendation, obviously to alter that to see how something's going on pain. But that's not the case most of the time. Most of the time, it's elective medications, and they can actually have challenges beyond the pain relief that they're providing, because in many cases, not all cases, but many times they can be the smoke alarm, not the fire. They can be, so they cover up the smoke alarm, but that doesn't mean the fire's gone out, right? So they can take away the pain, but it doesn't mean that the ultimate challenge that's causing that pain has been healed or fixed. So, and I think that's an important component and a piece for patients to know. A lot of alliteration there, a lot of piece, but it's an important item for patients to know, is just because the pain is gone, I think it's important to go back to, just because the pain is gone doesn't mean the problem's gone away. And that's a really, really important component.
Jeff, it's been a pleasure having you on. I've learned a ton. I learned a lot
Yeah.
more about the profession of chiropractic than I knew. And we're always here to learn. I mean, that's the thing. And then just kind of like we said at the beginning of the podcast, bring different modalities to people that they may have never known about. I mean, we're in healthcare, and I think we both learned some things today. And, everybody has a unique niche, and it's great. And when those start to kind of interweave and people learn more about what others can do, I mean, it can really bring about a lot of healing for people that need some help.
Yeah.
Well, thank you so much. I'm super grateful to be on, and I appreciate what you guys bring. And I'm going to encourage everybody listening to recommend to a friend, because I know a lot of what you guys talk about on each episode is so important, and it's often, I'm going to say, overlooked or just not known by people. So being able to leave a rating or review for your podcast, if I had one ask of everybody listening and watching, would not be because of the information I provided, but it'd be because of the information you guys continue to provide, to leave a rating or review, share with a friend. It's really important information that you guys are bringing to light by highlighting what's out there and being able to put it in an actionable format. And for many people, they don't have access to that information. So I appreciate you guys having me on. Hopefully I was able to share a little bit, and I'd encourage everybody to share with a friend.
Absolutely. Thanks for doing our job for us there at the end.
Yeah. Thank you.
You're more than welcome.
But, well, Jeff, you're always welcome on the show. I mean, this was really great, and we'll catch up soon.
Thank you very much.